My guest today is one that I've been wanting to have on the show for a very long time. His name is Dr. Jason Saunders. He is really just the leading, I mean, I could be wrong, but from my perspective, he is the leading voice in hyperbaric oxygen therapy. I see him at all the conferences speaking on this. You know, he's a consultant to other practitioners. He has a certification. It's just awesome. I so appreciate Jason and his wife, Melissa. They're just amazing people. They got 3 little kids and they're just like killing it, just leading with their heart and soul and really bringing a lot of goodness into the health industry. Jason is a chiropractor specializing in functional medicine with a PhD in molecular biology and a focus in regenerative medicine. They own and operate 2 different clinics with featuring hyperbaric oxygen therapy. Such a mouthful. Make sure you check out his YouTube channel, website, Instagram, HBOT USA. So HBOT is a lot easier to say than hyperbaric oxygen therapy. I did it. It's something that I have tried myself. I don't know if you guys have. But it's so amazing, and I'm just not even going to spoil anything. I'm going to let Dr. Jason Saunders explain it all to you. This episode is brought to you by Peluva. So Peluva, Peluva, those are Mark Sisson's new zero drop minimalist shoe with that distinctive 5-toe design. I have been loving them. I've been a long time fan of barefoot shoes, and I was very resistant to the little 5-toe articulation personally at first, because just being real, I thought they looked really nerdy, and I was like, oh man, yeah, I love Mark so much and I get what he's doing, but I'm not wearing those nerdy shoes. And then Brad Kearns, who's also involved with that project, was like, no, Tara, you got to try them. Tara, you got to try them. Tara, just, come on, try them. And I tried them, and I kid you not, I enjoy them so much that I actually like how they look now. Weirdly, I can tell. So like the purpose of that 5-toe articulation is so that your toes can move more dynamically. So with other barefoot shoes, like I've been a long time fan of Vivos, and I'm still a big fan of Vivos, but they have just that big toe box, right? Which is awesome. So I didn't really feel like the 5-toe articulation was necessary, to be honest. But as I've worn them, I have experienced how awesome that is. It was actually been quite surprising for me. And I wore them this morning. I wear them all the time, and I'm really, really enjoying that freedom of movement on my toes. So yeah, Brad and I have been going back and forth. I'm like, dude, I actually love them. And he offered to sponsor the podcast with Peluva and also offer you guys a 15% off code, which I was like, okay, cool. Yeah, I will gladly introduce my people to Peluva shoes. So you can use code Coach Tara at peluva.com, or you can just go to peluva, peluva.com/Coach Tara, and you can get that 15% off discount. Make sure you snag some of the socks while you're there, because you're going to need the toe socks. Okay. So let's go ahead and get into the episode. Here is Dr. Jason Saunders. Okay, so Dr. Saunders, I was telling you before we started, I've been wanting to have you on the show forever. So I am super happy to have you as our first official expert on HBOT, hyperbaric oxygen therapy. You are the leading voice on this topic. And so I'm so excited for you to educate my audience today on the many amazing benefits of hyperbaric oxygen therapy. So thank you for coming on.
Of course, Tara, thanks for having me. Like you said earlier when we were talking, I mean, we've crossed paths so many times, and it was just meant to be. So I'm glad
Yeah.
to be here, and I love to share as much as we can in the time that we have.
Yeah, awesome. Okay, so let's get right into it. What is hyperbaric oxygen therapy for people who aren't familiar?
So as simple as it can be, essentially every cell in your body uses oxygen other than the red blood cells that typically carry oxygen around our body. We're limited to the amount of oxygen that we can carry under normal atmospheric conditions based on how much our red blood cells, can carry based on the pressure. And so hyperbaric is really just exposing somebody to a temporary increase in atmospheric pressure. And pressure is what drives oxygen into our circulation. So as we increase the pressure that someone's being exposed to, we can massively increase the amount of oxygen that's being absorbed. And then that is really what creates, I would say, the first surplus of oxygen that the body can now utilize that, for healing, recovery, regeneration, whatever the body needs the oxygen for. But this is really the first time someone goes in the chamber is the first time they're really having a surplus of oxygen to, go above and beyond what they're typically able to carry.
Awesome. Okay. So, in case people haven't been exposed, I think probably a lot of my people have at least seen these chambers, but can you describe the chambers? And also, while you're at it, there's the soft shell and the hard shell. And can you talk about that?
Sure. So, people are like, well, do I have to go inside this thing? You do have to go inside this thing. Um, there's a lot of different shapes, there's a lot of different sizes. I think a lot of people, myself included, you're nervous. You've not been inside this device. This device is pressurized. But really, once you almost even in the smaller sizes, like the one thing I hear, well, I had an MRI and I can't lay in something. Like you don't have to lay still, and these things, even smaller chambers, are exponentially more room than like a typical
Hmm.
MRI experience. So, they're actually pretty comfortable. You're
Hmm.
on a mattress. You're usually on a pillow. Um, Most people doze off at some point, and even though there's usually, they could be acrylic, they could be steel, they could be soft, they might have windows, or they might be one big window. But quite honestly, even people are a little nervous in the beginning. Most people ask us to like cover the windows, like they want it almost becomes like their little cocoon,
Yeah.
and they enjoy the privacy and they enjoy it's almost like the 1 hour in a given day where nobody can get them. And so, people actually start to enjoy that aspect of it quite a bit. There are different materials to your point. So, soft chambers, which could be used at home or in a clinic, but they were originally, I guess, designed a little bit more for home use. They're obviously a softer material, and as a result, they really just don't go to as much pressure. So they're still therapeutic. There's still a lot of value there, but they just cannot get to the same pressures that a hard chamber can get to. So we use we talk about it in atmospheres, which is a new term for a lot of people if you're not into hyperbarics. But right now I'm at sea level, so we just call that 1 atmosphere of pressure. And so, soft chambers go to 1.3, so about 30% more pressure than what we're getting right now. Hard chambers can certainly do that, but they can go, a clinical chamber might go to 3 atmospheres, so 3 times the amount of pressure. Diving chambers, like around scuba diving, those are 6 atmosphere chambers. They go to like, 6 times the amount of pressure. And that's just the pressure. We could then also add oxygen. So pressure is one component of the way we create this surplus of oxygen. And then by adding enriched oxygen, that becomes like a multiplying effect on top of the pressure.
Okay. So, for these ones with like the higher pressure, the scuba diver ones, like I haven't been in one of those. What is the experience like?
I mean, honestly, they're usually not as nice as the clinical ones because they're for like emergency purposes. They're
Mm,
usually just steel with a steel bench, maybe one window. They're really just meant for like somebody was scuba diving, they're severely injured, and
mm,
hyperbaric happens to be, virtually the only tool that can help somebody if they have decompression sickness or decompression illness. We used to call it the bends.
mm,
Um, and so it's like you get off the dive boat, you get them somewhere, you throw them in a chamber, and you can spend, in those cases, that could be a 6 hour, 8 hour, 10
mm,
hour session. It's like a really
mm,
long kind of life or death scenario versus the clinical ones, which are a little bit more, especially now, a little bit more like nice, comfortable mattress,
mhm,
nice, comfy pillow, and, nice
mhm,
lighting. It's,
mhm,
it's a whole,
mhm.
it's a whole different experience now, especially in some of the clinical ones.
Okay, cool. Yeah, I'd say, my experience in them, it's like no big deal. It's actually kind of like if you liked forts, if you made forts when you were a little kid, it's like a dream fort. And
It's a
it's
dream
not
for
it's not intimidating at all.
I
It's just
love it.
nice. It's like, oh, it's fun in here. It's kind of fun. And
Yeah.
there's, it's no big deal, I'd say. You can let me ask your thoughts on this. Working on your phone or laptop, like what are your thoughts on that?
So technically, inside the industry, electronics are not supposed to go into chambers.
Okay.
So batteries and pressure don't mix very well. And so
Okay.
while I've seen that out there, it's really
Right.
been it's generally uh, frowned upon, I guess I would say. It's not only that though, what I would say is just like it's a fort. It's like people like to get away.
Yeah.
And quite honestly, to use that time to relax, meditate, breathe. I mean, that's you're in there for even if you're using it for wellness purposes, which I still do even today, you're in there to get a break from all the things that we're
Right.
typically doing. Like to sit there and scroll Instagram for 60 minutes
Right.
isn't going to decrease your stress levels.
Yeah.
It only kind of adds to them. And so, I try to convince people to just use the best of their time and really like,
Hmm.
find a happy place, do some good breath work, and really get the most out of the oxygen.
Nice, thanks. Okay, so let's talk about applications for people, like all the way from, healing practices all the way to athletic performance to everyday people. Can you talk about who might and why might people use
Yeah.
hyperbaric
So,
therapy?
you know, for a long time being in this field, it got a bad name. Like, how could one machine help so many people with so many issues? Like, it's a cure-all. It must be snake oil. It's like, how could it? It can't possibly help so many people. And I've spent pretty much my whole professional life at this point trying to help people understand that concept because what I would say is number one is it's not even though we use it, even in traditional medicine, we use it to treat certain diseases. I would say it's not a treatment or a cure for anything. It's literally just giving the body oxygen and then allowing the body to utilize that oxygen for healing the same way it would even under normal circumstances. It's just here's an extra amount of this ingredient that would otherwise be impossible to get. So, and then when I talk about, I guess that continuum of, let's say, helps, sick people improve their health, helps, moderately healthy people get a little bit better, helps with performance. And then there's this whole like optimization and longevity side. And so, what I would say is this, this is just my belief system. I think you probably share it. I mean, not only with hyperbaric, but even when I'm talking about like diet and fasting and diet variation and pushing certain diet pathways periodically, pushing certain exercise pathways periodically, there are certain requirements that humans need to be healthy, period. Right? Like diet and exercise is a foundational concept that we at least all maybe don't all do all the time, but we at least all understand that those are actual requirements. Like you can't exercise your way, through a bad diet, and you can't eat your way through a sedentary life. Like you need to do both, and they both need to be there as a foundational component for somebody to be healthy. What I would say is oxygen is also one of those ingredients. And there's a few others like light and, a few other ingredients that I would just say are these are just human requirements. And so when you understand that it's a human requirement, then you can start to say, well, maybe if somebody was sick, the strictness of a certain diet that they may have to follow is far stricter than if somebody was moderately healthy and just trying to maintain their health. Or if they were healthy but they really wanted to like train for a performance activity or a show of some kind, well, now I have to get really strict again because I'm asking a lot more of my body, right? So the ingredients are going to be the same, but the level of dedication and the aggressiveness or intensity of whatever the thing that we're trying to do needs to adapt based on the goals. And so I would say the same is just true of oxygen. When somebody's really sick, oxygen will help them. It reduces inflammation. I mean, just categorically, it reduces inflammation. It improves cellular performance. It improves our immune system's ability to fight infection. It increases, mitochondrial function, so like cellular energy production, essentially. And then it stimulates a whole range of growth factors like brain-derived neurotropic factor, like, insulin-like growth factor, like anabolic pathways that are meant for healing, repair, and regeneration. Collagen, new collagen growth, fibroblasts, which are what would grow like soft tissue, like ligament, tendon, muscle tissue, things like that. So when you understand that oxygen will play these various roles, and you say, well, here's a disease process. Well, the idea that they might need a lot more hyperbaric because they have a lot more inflammation or they have really low mitochondrial function and we're really trying to step that up. So that the pressure that they might need is going to be higher. The frequency and durations that they're going to need are going to be more aggressive. Me as like, I'm not chasing anything right now, neither a sickness, nor am I really like going bonkers on my, optimization in this moment. So, for me, mild or moderate pressures. A soft chamber is more than enough, and I don't have to use it 7 hours a week. One or two is more than enough. So we try to say, listen, here's an ingredient, and here's either the condition and how severe is it, or here's the goal and how audacious is it, and how do we create a program of pressure, frequency, and duration that's going to best match that goal. On the disease side, we see things like autoimmune conditions respond incredibly well.
Mm,
Um, Neurodegenerative diseases, very, very well. Post-stroke, a
mm,
lot of neurological issues, post-stroke, MS, cerebral palsy, Parkinson's. A lot of these, our brain only makes up about 2% of our body mass, but it uses up almost 20 to 25% of all of our oxygen. So the brain is incredibly metabolically active, needs a ton of oxygen, and is really limited to how much it can get under normal circumstances. So we see amazing changes from a lot of these neurological conditions. But again, all of those categories, and then infection, even in traditional medicine, it's used for infection pretty regularly. And so, in our world, we can use it for just less aggressive infections like traditionally they might use it for gangrene, and where you might even end up with like an amputation. We might use it for Lyme or mold or H. pylori or C. diff, similar, conceptually similar types of infections, but maybe less intense because the infection, even though it's chronic, it's less severe than something, let's say, like gangrene.
mm.
On the performance side, every athlete on planet Earth, knows about and has at least considered some type of maybe performance enhancement, even all the way up through like blood doping. Blood doping is all about increasing red blood cell capacity so that we can increase oxygen capacity. And so hyperbaric is essentially, but you can get in trouble, obviously, if other than like altitude changes, if you're actually taking something to stimulate red blood cell production, that's where people, get in some trouble. But hyperbaric's able to increase the amount of oxygen in your body and bypass the red blood cells altogether. So there's an incredibly high amount of oxygen delivery with hyperbaric, actually more oxygen from hyperbaric than blood doping could ever do. But essentially it's legal and it's not traceable and it's considered to be a perfectly okay thing to do even inside the elite athlete arenas. And so but by delivering more oxygen, we should expect to have a higher work capacity. So there's an incredible, performance enhancing component to that. And then I guess on the finish it on the longevity side, you could say that everything that the body would have needed to heal on the disease side of the equation is not that dissimilar than what we're looking for on the longevity side. Old injuries, chronic stress, elevated levels of inflammation, old concussion, just things that added up over the course of our life are really the things that start to break us down prematurely. And we can utilize the same tool, oxygen, essentially, as an ingredient for the healing and recovery and regeneration, and basically to at least slow down the aging process, if not like some of the research that even has been done before me and some of the research that we've done has actually even shown reversal of biological aging as a result of hyperbaric. And so there's an incredible, biological age component to this when that's what somebody's looking for.
The neurological stuff and brain, I when I was very, very deep in the keto world, I mean, I still have some clients doing keto right now. I'm not like apart from it, but when I was like all in on keto, I remember that, the topic of using keto combined with HBOT for traumatic brain injury was something a lot of people were looking into. So my first question is, I'm curious on this one. It's a little bit selfish, but hey, if you
Okay.
have traumatic brain injury, this part's for you. I One of my closest friends did a full career in the NFL, and I've coached several guys coming out of the NFL. And like, you're probably familiar with that study they did. They had 111 brains of guys who played in the NFL, and 110 of them had CTE. Like it's like they and I see they're kind of like a silent suffering crowd. And obviously this could be other people who just had a lot of concussions or maybe even just played sports into college or whatever. It's like I feel like there is so much suffering happening there, and they're not really talking about it because it's like, oh, boo-hoo, you made millions of dollars and we're famous. Like, sad for you. Like, they don't talk about it, and it's really bad, you know. And so I'm curious, do you have any insights for people with traumatic traumatic brain injury, CTE, something like that with HBOT?
So, I mean, there's been a number of studies on hyperbaric and concussion, hyperbaric and TBI. Um, the largest study to date on hyperbaric and TBI and PTSD is going on right now
Mm,
at University of South Florida. They're looking specifically at vets and the effect of like
cool.
blast injuries and TBIs. But this will
Nice.
be the large, I think it's actually the largest hyperbaric study, period. But it's
Okay.
also happens to be looking at concussion TBI.
Cool.
Um, you know, as long as you know, this is just a position that I have in health in general, but like as long as you're alive, you still have a capacity to heal. I mean, that's part of the definition of being alive. And but because we're limited to the amount of oxygen we can carry, and because these injuries are typically cumulative and repetitive over, you know, a career, let's say, whether that's a vet or a MMA fighter or a football
Mm-hmm.
player or even soccer players, you know,
Mm-hmm.
we had a whole movement a couple of years ago. We went to Hawaii to treat the surfers. There's a whole conversation about TBI with regard to surfers when they're, you know, on big waves and smacking the water at,
Wow.
you know, fast speeds. And so, you know, this is something that it's throughout, you know, it's throughout a lot
Mm-hmm.
of different industries.
Mm-hmm.
Creating an environment to heal the brain is not, you know, when I went to school, which wasn't even that long ago, we sort of talked about the central nervous system is really that's whatever you have, and whatever you
Mm-hmm.
broke, and there's not a lot of coming back from that. And, you know, in the last 5 or 10 years, we've seen that completely out the window. And we know that there's a number of things we can do to heal the brain. You
Mm-hmm.
know, I wish, you know, like for me in my clinic, when I'm treating kids that play football or soccer, like even a single concussion, they're getting 10 hours of hyperbaric like right out of the gate.
Okay.
I think if we're more preventative and proactive,
Mm-hmm.
we would
Mm-hmm.
never even get to the place that
Mm-hmm.
you and I are talking about this with
Right.
regard to like the football players. But, you
Mm-hmm.
know, essentially they've had high school careers and college careers and professional careers where it's just repetitive, suck it up, get back on the field. You know,
Mm-hmm.
if you can do it, do it. And your paycheck relies on it in many of those
Right.
cases. And so unfortunately, a lot of them pushed it pretty far. But even for those that have been, you know, already diagnosed and pretty sick in that way, we've seen incredible comebacks. And so, you know, without a doubt, and this isn't the only piece of the puzzle, but this is a huge piece of the puzzle. And like you say, you know, do keto, but not forever. Like there's a time, let's say the brain preferentially would burn a ketone over a molecule of glucose. And the brain can't burn fatty acids. Like our muscle tissue can burn fatty acids. Fatty acids can't get into our brain. So the closest thing our brain has the capacity to burn from a fat standpoint is a ketone body.
Mm-hmm.
And if you gave a neuron either a molecule of glucose or a ketone body, the brain preferentially burns the ketone. And so if you're putting that person in ketosis so that you're giving them a much cleaner fuel source and you're driving high levels of oxygen simultaneously, you're starting to get a synergy between, you know, the metabolism of our cells and really improving the metabolism to allow for healing to occur. So, you know,
Mm-hmm.
I agree with, you know, we use different diet strategies at different times, and we pulse them and you
Mm-hmm.
know and modify them over time. But you know, there's a time and a place for all of these things. That they
Mm-hmm.
work incredibly well. Ketosis works incredibly well, and we use it. Even today, we use it consistently for a lot of neurodegenerative and traumatic brain related issues, along with oxygen. There's a great synergy.
Mm-hmm. Yeah, thanks. Okay, so I'm curious, I know there's no magic formula protocol unless you found one and you want to, yeah, everyone's different. So it's like, it's going to be different. But, you know, at least informing people, it's not necessarily something you just go do once and you never, you know, 2 years later, you don't do, you know, can you give some education on the
Yeah.
frequency, some semblance of an idea of what to expect, of what to get benefit from it?
So, yeah, what I would say is that there are short-term benefits and long-term benefits. That's just one thought process. Short-term benefits you can get in a single session or two or three, you know, certainly less than 10. And then I would say the long-term benefits are things that really cellularly things are changing every session, but we don't see that certain pathways are really triggered until there's a repetitive amount of exposure over a period of time. And so a lot of the long-term benefits, I would say, only start to begin by sessions 20-ish, 20 to 25.
Okay.
You'll see a lot of the research, talks about 40 hours as kind of like the magic number. I don't
Okay.
know that that's the magic number, but certainly, 20 is a minimum for a lot of these. So short-term benefits would be like you could see inflammation coming down pretty quickly for people, but you need the repetitive nature to keep it down, for some folks, but it could start happening relatively quickly. Increased energy production because we're driving more oxygen into the mitochondria, but almost immediately we start to see changes in cellular energy production, and we might even start to see some improved immune response, our ability to like for the immune system to fight infection. That's something that can start happening pretty quickly. The things that most people really want, like healthier and more mitochondria, new synapses developing in their brain, or
Hmm.
stem cells being mobilized to your body or your brain for like legitimate, healing and repairing of, senescent cells or old injuries. That's the kind of stuff that it won't even happen until we're talking at least 20 hours. And that's
Okay.
also in a relatively condensed window. So, you know, um,
How
just to give,
condensed are you talking?
yeah. So like I would say most of the time, like 20 hours in like 6 weeks or less.
Okay.
Or closer to 4 weeks would be better. So like 5 hours a week for 4 weeks, or 4 hours a
Mm.
week for 5 weeks, or a little more spread out. You'll still get a lot of those. Even when people say, let's just say someone came and they said to me, "Listen, I'm only going to do 12 sessions in my entire life. Should I come once a month for a year, or should I come every day for 12 days?" My answer would become every day for 12 days. At least you'd have a
Okay.
chance to get the some of
Hmm.
that cumulative effect. If you came once a month for your whole life, you'll get these little mitochondrial pushes, a little a temporary shift in inflammation, but you'll never get that real cumulative impact. Once you get that cumulative impact, like maybe it's an autoimmune disease and maybe somebody does 40 hours, if they get a good benefit, they're probably also not going to stop. But
Hmm.
you also don't need to do 5 hours a week for the rest of your life. Like once you create a lot of, it's like exercise. I want to become fit. I reached the level of fitness that I had in my mind. And so then I stopped going to the gym. I never went back. Like you can't expect to maintain those changes if you
Hmm.
never go do the thing that brought you there.
Hmm.
At the same time, the intensity or the frequency and duration of your exercise to get to
Right.
that place shouldn't be the same you need to stay in that place. So if you're
Right.
happy with where you are, you can kind of reduce things and create
Hmm.
more of a maintenance type of plan. I would
Hmm.
view hyperbaric identically. I'd say, depending on the goal, we create one program to get you to a certain place and another program to keep you there. On the longevity side, it's similar. You might need less pressure, and maybe you'll get away with spreading them out a little bit more, maybe 2 or 3 a week minimum,
Mm.
but you should still do a 10 to 20 hour program to start triggering those long-term responses. And then you could move into some type of like maintenance program. But,
Okay.
we get calls from people like, "Hey, I saw you, maybe they saw me on this thing and they live near my office. I want to come in. I think I want to do this like once a month or 4 times a year." I'm like, honestly, save your money. I love this thing. It's incredibly powerful. We use, my office, we use a ton of different toys and we have all the tools and things. But Hyperbaric's by far one of the most powerful ones out there. But it needs at least some type of introduction like that in order to really like take hold on someone's physiology.
Thanks. And you guys are in Miami, right? Are you in
We
Miami?
live in Miami. I have two offices. One is in New Jersey and the other's in Pennsylvania.
Okay. And that
It's a
kind of
bit, it's
leads
a bit
me.
of a commute.
Yeah. Hey, Miami is a pretty cool place, so it's worth it.
Yeah.
Okay, question in term this is probably my biggest like, oh, and I'm sure you feel the same way. Accessibility, right? That can be an issue for people. So what do you recommend? You know what I mean? Like, okay, if you need lots of sessions, would you say, dude, make the sacrifices to get your own thing, or like, you know what I mean? What do you recommend in terms of accessibility issues?
So, again, it is one of the reasons why like the soft chamber market, I think, has been growing so much and is a good
Mhm.
reason for that. Some people, Uh, some people really need higher pressure. There's like a specific issue that they're dealing with, or for whatever reason, their body, and it's like, listen, if you're not getting that higher pressure, you're just not going to get the benefit. In which case, it's much more complicated to do a higher pressure chamber in somebody's home. It's not impossible, people do it, but it's much more complicated. And
Mm,
so in those cases, sometimes, going to a clinic is really important, or doing their first protocol at a clinic could be really important to like start getting the changes that they're trying to get, but then they could maybe maintain them in a home chamber afterward.
okay.
In our office, we run a couple hard chambers, we run a couple soft chambers. We also rent chambers. We help patients get chambers. So, we have a few different ways depending on, they need a lot of sessions, but they only need it for 4 to 6 months. Don't buy one. There are rental
Mhm,
opportunities out there, and that'll
mm,
soften, first of all, make it super convenient
mhm,
and reduce the overall cost. Um, you know, we've, I teach hyperbaric medicine. I help people open hyperbaric clinics. And so, we've had the ability, I think we've certified over 600 people in hyperbarics in the last few years. I've personally been involved with about 45 different clinics opening all over the world. It's still nowhere near enough, but like if there isn't a clinic near you, there will be one soon, most likely. And if there isn't, then yeah, I mean, the rental option or the purchase option, and then the only if whatever the reason you need it, could be obtained through using a mild chamber at home. The only difference would be the number of hours that it might take. So,
mhm,
if I maybe there was 40 or 50 hours in my office at 1.5, atmospheres. So now maybe it's like 70 or 80 hours at home in a soft chamber potentially.
mhm,
So, but I always try to tell people if you've never been in one, at least try it. Like try to find a
mhm,
place. Go. I would
mhm,
hate to have someone buy something or rent something for a chunk of time, do one session and find out for some reason that they're struggling with being able to do it. So I
mhm.
think at least trying to find a place and do a handful of sessions, at least get comfortable with it and understand the process before kind of diving into the full-blown home model. But my vision for the future would be almost, the way not everybody, a lot of people have a home gym,
Mhm.
or at least some
Mhm.
exercise equipment. Like a lot of people are building some of these devices into their home. I think, a chamber at home for longevity purposes, even if it's soft chamber 1.3, I have no idea, thousands and thousands of hours. I've been doing this for almost 20 years.
Mhm.
So, I'm a firm believer in this is part of a healthy lifestyle, the way,
Mhm.
diet and exercise would be.
Okay, so your clinics are called just HBOT USA? Is that the name of your clinics
So
or
yeah, I mean, the company's HBOT USA, and then we have like HBOT New Jersey and HBOT
Okay.
Pennsylvania. And then
Okay.
on our website, we have a locations page. It's not
Yeah.
everybody I've, trained, but the groups that I've trained and have like stuck with us so that as new research is coming out and new protocols are coming out,
Mhm.
we have like a tight team of practitioners that collaborate essentially. Those are the people on the locations page. So,
Cool.
there's quite a few, not, we don't, again, we could 10 times the number of clinics and still not have enough, but that's a good place to start if you're looking for a
Mhm.
clinic. That'd be
Mhm.
those people I trust inherently.
Awesome. Yeah. And then I'm thinking, well, I'm on the big island of Hawaii right now, and I don't know if there is HBOT anywhere here. It's pretty rural. There could be.
Yeah.
I haven't seen it. But in Utah where I was before, I can think of a couple places like IV drip. The IV drip place had one. US cryotherapy. It's like a cryo biohacking place. They have it, and so probably chiropractors offices, some of them might have
Yeah.
it. I'm just trying to get, I guess if people Google, they could check your locations page, but if they can't find anything, just Google it and that you might be surprised. And
You
then
would be. Yeah.
the other barrier I'm thinking people might have is like, okay, like, so do I need like a practitioner to teach me how to do that? Like, who do I go to? Let's say they can't find somebody on your locations page or they can't go to one of your places. Like,
Yeah.
what's the
I
steps
mean,
for them?
most manufacturer, I mean, if it's a reputable manufacturer, would offer some training. So like
Mhm.
ones that are meant for home are not overly complex, and
Mhm.
they should come with some amount of training. We offer
Hmm.
training for home use people the same way. It's a different kind of training, obviously, the
Yeah.
way like than the training for a practitioner. But you want to know, you certainly want to know the basics. You
Hmm.
want to know how to keep you and your family safe. Um, and there's a tendency, let's say for there is no place near you. You bought a chamber. You're like, oh my God, this thing's amazing. How much effect I've had. Some friends, some family. Next thing you know, you're like the neighborhood HBOT clinic in your living room, which is
True.
a dangerous, that I mean, it's a potentially dangerous place to be because now you're putting you don't necessarily have the training to understand all the ins and outs of like the
Right.
varieties of people that you might be seeing. It's one thing to be like, I
Right.
understand my story and why I'm going in and what my issues are, but then, you know, so that's a slippery slope, I would just
Right.
say. But I think, when we went to Hawaii, we did a couple trainings. So I know that we had like 3 or 4 clinics on Oahu. We had 2 in
Hmm.
Maui, I think 1 in Kauai, but I don't know if we made it to the anyone
Hmm.
from the Big Island made it to us or not. Um, but yeah, I mean, essentially, a lot of different practitioner types are utilizing hyperbaric, and it's growing
Right.
incredibly quick. So,
Yeah,
uh,
for sure.
yeah,
Okay, because I know you are all up in the biohacking world and I see you at the conferences or whatever. I'm curious if you have tried different adding different things. Like, people will take chlorella before or spirulina before they get in red light. Like, do you have any advice on like stacking or
yeah,
optimizing the experience that way?
definitely. I mean, um, so first of all, just for your listeners, if they're interested, we've done. I think I have 600 some odd videos on YouTube in
Wow.
like 5 to 10 minute increments on every topic so
All
far
of
that I
this.
can think of.
Nice.
And questions that we get on that channel. So that's HBOT USA is that channel. But
Amazing.
I've gone through videos going through questions like this because I get it very often.
Hmm.
What I would say is, more than I would say that there's like, here's the HBOT stack, I'd say, what is your goal, right? So if
Right.
somebody's goal was to improve mitochondrial function, then I'm like, okay, what are all the rate limiting steps to mitochondrial function? So you know, uh, fasting may improve that, or at least access to some type of NAD or NAD precursors like NMN or NR. CoQ10 could be part of that.
Hmm.
Um, Obviously, hyperbaric is part of that. Red light for the cytochrome C um, oxidase, stimulation. Um, so I would create like a mitochondrial blend for those kind of people.
Hmm.
Um, if it were to reduce inflammation, well, then maybe I would shift that and say, okay, well, hyperbaric reduces inflammation. Sauna can reduce inflammation. Ice bath, does that. So maybe some contrast therapies along with
Hmm.
hyperbaric. And here's, a few supplements that we also know happen to, curcumin and,
Hmm.
that or certain enzymes, nattokinase and serrapeptase,
Right.
so maybe I'm trying to detox. So hyperbaric's incredibly powerful for detox. And maybe we mix that with some binders and we
Hmm.
mix that with also sauna. So we're like doing some
Hmm.
hyperbaric, we're taking some binders, we're going into the sauna. So a
Hmm.
lot of these tools and strategies are great stacking,
Hmm.
but we just have to be careful with, not careful, but um, maybe
Mindful.
strategic with,
Yeah.
what am I trying to accomplish? And
Right.
therefore, again, hyperbaric happens to be one of the ones that I'd say are very foundational. So hyperbaric can be included in a lot of stacks for a lot of different purposes.
Hmm.
And the other pieces of the puzzle that are maybe a little bit more targeted, right? I might do it with peptides, all right? So hyperbaric stimulates a lot of growth factors and reduces inflammation. Maybe I mean, I did this for my own shoulder issue. Like I combined it with, BPC 157 and some ipamorelin, like I was trying to repair a torn
Yeah.
labrum. And so
Mm.
again, hyperbaric was the foundational ingredient, and then I was hyper targeting, with other ingredients, trying to create the like the full stack.
Mm. Love it. Okay. Awesome. Thanks.
You know,
Yeah.
we
We'll link up.
do like, not that you're, I don't know, but when I teach this stuff, we go through a lot of these variations because a lot of the practitioners use different tools like this. And um, I try to help them understand, you know, not everybody should be doing everything every day, right? So
Yeah.
understanding, here's my toolbox, here are the
Mhm.
people I'm working with, and how do I best apply this toolbox to these people?
Yeah, I believe my bestie did your certification. I would assume she's very much in our world, and she was like raving about it and raving, raving, raving. All this, she was like the evangelist for HBOT. Like, just could not stop talking about it after, and it was so enlightening. So if anyone's listening and you are like in the health space or whatever, like I just want to send you over to HBOT
Yeah, I
USA's
appreciate it.
website and check that out. Yeah.
You know,
Um,
yeah, so HBOT USA is like an educational website. We sell
okay.
nothing, we offer nothing other than, does this thing work? Is it appropriate for you? Should you consider it? It's really just for like
Uh huh.
either consumers or practitioners trying to understand more about what this thing is.
Uh huh.
And then the hbotcourse.com, literally
Okay.
just, THEHBOT course.com. That's where
Nice.
like the trainings live, or we do live
Okay.
and online stuff. So all of that's embedded into the
Nice.
hbotcourse.com.
Okay, thank you. Awesome.
Yeah,
Okay, one last kind of big health question because
sure.
I know you speak on this, and I feel like it's just so needed for my ladies out there. My burnt out like Gen X, like getting into menopause or post menopause. These women, I just feel like the programs of society that they grew up with, generally speaking, were just like drive yourself into the freaking ground, helping everyone constantly. And it's like these beautiful women, they're like a little bit burnt out, a lot of them during, and then also just getting slammed in like the pinnacle of processed foods and chemicals and like just, you know what I mean? Like right
Yeah,
during menopause,
all of
like
them.
holy smokes, the food system issues, the, soil declining nutrients, like, oh my goodness. So, HBOT during menopause, cognitive clarity, hormone balance, like any insights there for women?
So a bunch of things. And I know this is like part of what you also talk about and are, interested in supporting is that there's that shift, especially, you know, women's hormones are far more complex than men's will ever be. But with menopause, that shift of like ovarian function to adrenal function. And, there's a lot there. And I know you've covered that, I'm sure, with your audience in great depth. And a couple things. Number one, hyperbaric, hormones are manufactured by our body. And so that's a energy expensive process. And so we see changes in neurotransmitter function and we see changes in hormone function by upregulating the oxygen inside anybody's body.
Mm,
The other thing that hyperbaric has a huge effect on is the parasympathetic system. And so,
right.
when we're taking these people and we're trying to heal them, yet they're still stuck in the world that they're living in at that time, which is the environment that's driving that sort of push, push,
Mhm,
push. They're living in that sympathetic nervous system, that fight or flight chronically, and they really
mhm,
don't get a chance to shift back into their parasympathetics, which is where healing occurs, where hormone production is going to occur. And so to get anybody, but to get these women back in their parasympathetics has an incredible impact on that whole adrenal hormone function
right.
and balance. And so, almost everybody, men and women that go into the chamber, we see that shift in parasympathetic tone, which is really important for all the healing and recovery. We see that
Mhm,
on people who track like HRV and, deep sleep and REM. Like we see improvements across the board in all of those factors for people who are doing hyperbaric. And so, between the both the hormone and neurotransmitter rebalancing and then that autonomic nervous system, that
mhm.
parasympathetic shift, um, we see great changes for women going through that.
Yeah, I bet. It's like a double whammy of just having a reason to lay down and chill for an hour, which when you're in the habit of like, I have to be in charge of everything and get a million things done and my to-do list is forever. And like, you're almost like, I've definitely worked with a lot of women that I'm like, how would you feel in your body if you just like laid on your couch and did nothing in the middle of the day? And they're like, No,
Right.
it would be
You know,
torture, and I'm like, oh, okay.
and maybe like eventually, like it's like those habits that we're all used to.
Hmm.
Like when and if, let's say, the chamber becomes a habit, it's like
Right.
you you don't bring your phone, so nobody can
Hmm.
text you and give you grief
Hmm.
about whatever thing you're not doing right now. You bring a book and you read a little bit, and nobody can get you because you're stuck in this thing that nobody like
Hmm.
you're not stuck in it, but like you're in this cocoon, you're in your fort, right? You're in your
Yes.
fort.
Yes.
You're 7 years old, you're in your fort, and like this is you time. And as I'm sure you know, and I'm sure you preach and teach, like if you're not getting that kind of time in your life, like you really don't have a chance. Like you can't be the supportive person that you're
Right.
trying to be in the role that you're trying to fill in your life if you're not taking
Hmm.
care of yourself. And I know that that's a time issue and it's a commitment issue to ourselves. And there's a lot behind that, but
Hmm.
um, having the tools in our life that force us to commit
Hmm.
ourselves will
Hmm.
always make us such a better version for everybody else. And,
Yeah.
I know my wife goes through that too. And like, you know, I think it's a conversation for men and women, but I think we
Yes.
see it show up in women far more, or maybe we're more willing to talk about it. I'm not sure, but uh,
Right.
in any
Or maybe,
case, it's
and
important.
a more complicated system, with the menopause and all of that. Like there's a lot of change going on. So if it's a stress system and there's a lot of complicated things happening, the likelihood for things to start going wrong are a little higher. And yeah, thanks for mentioning that. I think if you are a high performer, and even if you're just a parent, you're a high performer. But that in and of
If
itself,
you live on planet Earth, you have a
yeah, if you live on
family and
a
a
you have a
job.
job, right. And it's like, in order to support that, they're becoming protective over my parasympathetic, meaning protective over my bedtime, protective over my like I cannot perform at high levels all the time, or I just will just
Yeah,
trickle right
burnout.
down into mid performance. So I'm very protective over my downtime. And that's the part people don't see. They see me at the gym, or they see me running retreats, or they see me on a podcast. But it's like I'm kind of like an intermittent faster of stress. I will not do it all day.
Yeah.
Absolutely not.
I have a 4 to 6 hour stress window,
I do. I do.
and
I
then I
wake up
fast from
slow.
stress.
I hit the gym. I do all the content, blah, 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 a
Yeah.
few hours of work. And I'm like, that's it. That's all I can handle.
Yeah.
I bust it, but and then I'm done. So yeah, I appreciate.
Maybe you should start sharing and documenting your downtime.
Yeah, I know. Except I don't want to pull my phone out.
Yeah, that's true.
It's a stressor. I know. My friends have told me there's like Tara, people have no idea how you because I'm like, I'm not, I'm bye. I don't feel like being available to anybody. I'm chilling. I'm sitting outside. I'm listening to the birds. I don't want to be Coach Tara during those times. I want to sit and talk to my daughter.
Yeah,
you know?
that's that's incredibly important. Yeah.
So, well, just word giving you the word, but I'm not going to film it for you. All right. Wow, Jason, thank you so much. This has been so informative. And so, like, what did we miss? You have your HBOT course
So we
website,
have
HBOT.
the HBOT courses and like
Mm-hmm.
business consulting for people that are trying to open and get into the the business of hyperbarics. Um, a
You're
few
still speaking up a
books.
storm?
Yeah,
Okay.
I travel a lot speaking at,
Uh-huh.
biohacking or like medical, like A4M and other medical conferences.
Okay.
My goal, to your point earlier, my goal is access. I decided about 6 or 7 years ago that, you know, there's really, I wasn't seeing any meaningful attempt to get enough information so people knew what this thing was and how
Right.
important it was, but there wasn't anything out there about like how are we going to get more change? Like if everybody who
Mm-hmm.
knew that they wanted and needed hyperbaric actually went to go get hyperbaric, we wouldn't have enough chambers on planet Earth to service these people. So,
Mm-hmm.
really trying to grow the industry so that we can actually help as many people who would actually benefit from it. Um, we
Books.
have a few books, like
Yeah.
a book for everybody, Oxygen Under Pressure, just to get a better idea of like how does this thing work, and maybe some philosophy just on like health overall, which I'm sure you would
Yes.
you'd be fully in line with what we have in there. And then last fall we wrote a textbook, so the art and science of hyperbaric medicine. That's really like a practitioner driven, like it's a pretty heavy science book, but
Okay.
like legit textbook on it. So we have,
Wow.
and then the YouTube channel and other things, but essentially most of what I do is just offer information because you know I'm so passionate about not only hyperbarics, just like you, just there are there are so many people that don't realize that they're right on the edge of something great for themselves, their health, their
Right.
life, or their own performance, or just having the life that they knew that they wanted and always thought that they deserved, but just can't
Hmm.
quite figure it out. And it's
Right.
just for you and I, like maybe we got lucky, we stumbled on the right thing at the right
Right.
time, but like it's always just getting the right pieces together where
Hmm.
whether that's in your business and your professional life or it's in your personal life, and there's so many great resources, like all the good stuff that you're putting out there as well, and other people. It's like, got to tap into some of these things and pick the ones that work for us, and then just, for 4 to 6 hours a day, run with it, and for the rest of the day, relax.
Exactly. Oh man. Okay. Well, thank you so much.
Yeah, no, thank you. I appreciate the time.
Appreciate that. We can tell that your heart is in the right place, your soul's in the right place. You're just like, let's help the people get better. Let's educate more leaders. Let's get this whole thing like amped up. So appreciate the work that you're doing, and thank you so much for taking the time and sharing with us
My
today.
pleasure. Thanks a lot, Tara.
Thank you so much for joining me on this episode of the Inside Out Health Podcast. I hope it's been helpful to you in your journey. If you think that it might be helpful to someone you know, please share it with them. Please share on social media. It really helps me grow the show and reach more people with these amazing messages. And if you could be so kind as to rate the show and possibly even leave me a review, that really helps. So much thanks in advance if you do that. And yeah, please subscribe if you want to hear more of this type of content. I have lots of amazing expert guests on the way. All right. Thank you.